Here are the top stories we're following. Medicare, Medicaid, and Social Security remain protected, but reforms are coming. President Biden and congressional leaders, including House Speaker Mike Johnson, have repeatedly emphasized that there will be no cuts to Medicare, Medicaid, or Social Security for legal beneficiaries. These programs are critical to millions of Americans, and both parties agree they must be safeguarded. However, there is a renewed focus on eliminating fraud, waste, and abuse. Officials are targeting ineligible recipients, including able-bodied individuals and those not legally entitled, to ensure resources are preserved for seniors, children, and people with disabilities. $14 billion in Medicaid fraud identified. Recent investigations have uncovered approximately $14 billion in Medicaid overpayments. A major issue involves individuals being enrolled in multiple state systems, allowing states to claim overlapping funds from the federal government. In some instances, individuals were listed in both Medicaid and exchange programs, leading to double payments. New push for work requirements for benefit eligibility. Federal health officials are promoting work or activity requirements for able-bodied Medicaid recipients. This doesn't just mean having a job, it includes looking for work, volunteering, or pursuing education. The intent is to encourage self-sufficiency and reduce dependency on public programs, a move estimated to impact $400 billion in federal spending. System sustainability and fairness remain key goals. Dr. Mehmet Oz, administrator for the Centers for Medicare and Medicaid Services, highlighted a core challenge: making Medicaid sustainable. While spending is increasing to support vulnerable populations, reforms are necessary to ensure the system serves those it was designed for, the elderly, children, and people with disabilities, not those exploiting it. He also noted the moral hazard of allowing people who could work to remain on government aid. The message is clear: preserving the integrity of public programs depends on shared responsibility and targeted eligibility. Reimbursement issues strain healthcare access. Another challenge raised is the payment disparity between Medicaid and Medicare. In some states, hospitals receive higher reimbursement rates for able-bodied Medicaid recipients than for Medicare beneficiaries, creating a misaligned system that discourages provider participation and affects access, especially in rural areas. Providers are reportedly scaling back because they aren't being paid adequately, particularly in mental health. Without reform, this trend could further limit access to essential care for those who need it most. Illegal immigrant claims under scrutiny. Federal officials are also examining claims submitted by states for illegal immigrants. For example, there are questions about why taxpayers in states like Texas or Mississippi should cover healthcare costs for undocumented immigrants in states such as California. Leaders say this is an issue of fairness and national accountability. Federal and state alignment needed for reform success. One of the hurdles in implementing these reforms is that states are financially incentivized to enroll more able-bodied adults, due to the 90% federal matching rate for Medicaid expansion. This creates a conflict, as states often receive more money for Medicaid recipients than for those on Medicare, despite Medicare being funded over a lifetime of work. Officials call for better coordination between federal and state governments, stressing that alignment of goals is essential for meaningful change. The president is reportedly engaged in finding common ground with governors and congressional leaders to push reforms forward. To recap, no cuts are planned for Medicare, Medicaid, or Social Security beneficiaries. $14 billion in fraud has been discovered in Medicaid payments. Work or activity requirements may be added for able-bodied Medicaid recipients. Federal officials are working to rebalance payments to ensure provider participation. Reforms aim to protect the system's most vulnerable, including seniors, children, and the disabled. Illegal claims and interstate payment imbalances are under review. Greater state-federal cooperation is needed to secure these vital programs for the future. These reforms are not about cutting care, they're about protecting it. As federal leaders put it, this is about restoring integrity to the system and ensuring America's most vulnerable continue to receive the care they deserve. If you found this report informative, please don't forget to subscribe to our channel. Stay updated with facts, not fluff. Click subscribe so you never miss a critical update. Thank you for watching.